Hi, everyone. Welcome to Dean's Chat, where we discuss all things podiatric medicine. My name is Dr. Jeffrey Jensen. I'm the host of the Dean's Chat podcast and the dean at the Arizona College of Podiatric Medicine. As you know, we like to highlight leaders in the profession, and today I'd like to introduce my guests as future leaders in the profession. First, I'd like to introduce Dr. Andrew Falco. Andrew is a graduate of the Barry University School of Podiatric Medicine in 2018. He completed the MedStar Podiatric Surgical Residency and then went on to do a fellowship at the University Hospital Foot and Ankle Fellowship in Chardon, Ohio. Welcome, Andrew.
Thanks. Pleasure to be here.
Oh, glad you could make it. Thank you so much. And my second guest, Dr. Garrett Nguyen, 2019 graduate of the Arizona College of Podiatric Medicine. He completed the Advent Health East Orlando residency program, and then went on to do the Foot and Ankle Deformity Correction Fellowship at the Paley Orthopedic and Spine Institute in West Palm Beach. Dr. Nguyen currently practices with the Paley Orthopedic and Spine Institute. Welcome, Garrett.
Thank you, Dr. Jensen. Thank you for the introduction, and thanks for having me on.
My pleasure. You know, Andrew, I forgot to mention, you're currently practicing in Fredericksburg, Virginia at the Dynamic Foot and Ankle Center, so I wanted to add that.
Yeah, no, thanks. It's been fun.
So we're on the Dean's Chat, right? It's kind of a fireside chat vibe. So it's low key. We go first name. So Garrett, Andrew, and Jeff. How's that sound?
Perfect.
Sounds great.
All right. Well, to get started, for me, this is really special because I got to know Andrew when he was at Barry University when I was there. And then when I moved to Arizona and became the dean at the Arizona College, Garrett was one of my students. So I'm super proud of you guys. I've been following your careers, and I'm real excited to have you on the show today. But what I'd like to do is kind of follow your pathway, how you discovered podiatric medicine, where you went to undergrad, what led, Andrew, to you going to the Barry University School of Podiatric Medicine, and Garrett, what led to you going to the Arizona College. Garrett, do you mind kicking it off?
Yeah, great question. Something that we often get asked, not just from students alike, but from patients. And so how did we get started into podiatric medicine, foot and ankle surgery, and how did we come to be where we're at right now? So mine started out a fairly young age. I've always been involved in sports medicine, and having flat feet, I did have a lot of foot problems per se, and being active, did a lot of sports growing up. So that got me involved fairly early. It wasn't really till about 2010, I did undergrad at FSU, that I became really involved in more in podiatric medicine and foot and ankle surgery. I went to Haiti after the earthquake a couple weeks afterwards and went with a team of orthopods and foot and ankle docs and teams of docs and nurses. And it wasn't then until I got really truly exposed to what foot and ankle surgery and podiatric medicine can really give back to the patient in a rewarding way. Following that, I really found my calling. I took like a 10-year plan and looked back and said, hey, how do I become the leaders in the field? I just Googled up podiatric surgery and podiatric medicine, foot and ankle surgery, and try to find those leaders in the field. Those are really pushing the envelope, and then looked at their resume and see how can I work my way back 10 years to be what they're doing right now, and then follow their footsteps. From then, I found some really mentors of mine, Dr. Shane and Dr. Reeves, who I actually shadowed before finishing undergrad, and then kind of being exposed to more of the surgery aspect, the medicine aspect, and it's really kind of brought me forth into residency. So I did my residency with them as well in Orlando. So it's kind of gone full circle, should I say, with them being my mentors, kind of leading up before entering podiatric medicine. This is before I applied, and then ended up doing my residency there with them. The process of going from, interest into kind of podiatric medicine surgery to residency, end up choosing you have a plethora of colleges that you can choose. And I kind of chose a pathway to kind of parity. I really truly wanted to focus on, say, I want to be really efficient in medicine, and then focus on podiatry and be a real expert in that. And so that's kind of where I met Jeff at Midwestern, and that's kind of how I chose that school. And Jeff's been really remarkable and bring up not just our field but research our school when he arrived, and he's been a big implemental key player in who I am today, and I can't thank you enough for that.
Wow,
With that said, end up doing a fellowship at the Podiatric and Spine Institute with Dr. Bradley Lamb. So I'm a huge component of fellowship, and I'm more than happy to kind of elaborate later on throughout the podcast.
All right. So. Fantastic. Thank you. What I was hoping we could do is after this introduction, we'll talk about the fourth year of podiatric medical school and what it was like to do clerkships and how you really kind of dialed into where you ended up at residency. So thank you for that introduction, Garrett. Andrew, do you mind sharing your podiatric journey?
Yeah. So, I wasn't, to be totally honest, wasn't sure what I wanted to do after undergrad. I did undergrad in Towson, Maryland. I was lucky enough to work for a neurosurgeon, 2 or 3 of them actually. And they were kind enough to take me under their wing and mentor me. Obviously very far from podiatry in terms of scope, but they were, always encouraged me to explore different options. And, I always had a passion for sports and continue to play today. And I've always, for myself, I always liked knee injuries or ankle injuries. And that's kind of where it was. So my pathway was always pretty clear. It's either going to be ortho knee or ortho foot and ankle, until I realized that there was actually another pathway. And I was able to connect with like a local podiatric surgeon. Just kind of eye-opening. You think you know everything until you realize you don't. So I learned quickly that there's another avenue, and I fell in love with something that allowed me to do everything I wanted. Not only treat a patient surgically if I needed to, be able to triage them and help them beyond just being limited. So it's been a really good experience from that standpoint. So I ended up going to Barry University for my podiatric schooling. And I think the reason I chose it was a multitude of reasons, but one of the main reasons was I wanted to understand how medicine was practiced in different part of the country. I had done everything kind of in the Northeast, Mid-Atlantic region. So I figured, going as far south as possible, ending up in Miami was just kind of a new way to see medicine in general. And I felt like it was a good way to expand my knowledge. And then, from that point forward, it was kind of full steam ahead in terms of, choosing residency. I was lucky enough to end up at MedStar, and then, Dr. Steinberg, who, a huge mentor, and also a role model, and someone who's very big on fellowships, which we'll touch on in a bit. His guidance led me to end up doing a fellowship just to further my education. So yeah, it's been a really wonderful experience, and, I'm surprised at how far I've come, but also, it's a very rewarding experience as well.
And, I've always said, you can see successful people coming from a long ways away. And I can say from both of you, I remember as students and then following your careers, there's no question. Time does fly though. And next thing you know, you're in practice. It's just incredible. So let's go back just a little bit. Let's go back to that fourth year of podiatric medical school. And, there's so many options for clerkships, and you can travel all around the country, and you can really see regionally, similar to what you were talking about, Andrew, the type of podiatric medicine and surgery and how it's performed. Can you each talk about your fourth year and all the different clerkships you did and how it kind of got down to the point where when the match came out, you ended up, Garrett, for you down in Orlando and Andrew for you in DC. Garrett, if you don't mind starting.
Yeah, great topic of discussion. I think it's something that's challenging for the fourth year students to decide. There's a host of residencies, and it's sometimes difficult to see why should I choose one residency over the other and apply to one over the other. So the way that I approached it was I broke it down. First, you make a list of your top 10 that are best of what they do. Each residency in respective fashion, they have their own specialty, something that they're usually good at or excel at, whether it be trauma, reconstructive, limb salvage, joint replacement, sports medicine. They always fit in a similar category of their own nature. From that, I picked what do I want to do when I get out of residency? What is my end goal? Do I want to join an orthopedic group? Do I want to join a podiatry group? Do I want to work in a rural setting? And how can that residency cater towards my skill set in obtaining that, say, long-term position in whichever practice you desire. With that said, I created my list. I want to be in Florida. I'm from Florida. What residency can prepare me to practice in Florida regionally? Everybody does practice differently depending on East Coast or West Coast, North or South. And then secondly, how can I get the best residency that would prepare me for reconstructive nature, being sports medicine, orthopedic mindset, and with the pathway to parity, I always wanted to be in an orthopedic practice. So I knew off the bat I wanted to be in a surgical residency that's heavy reconstructive, heavy orthopedic mindset and trauma mindset. So Orlando came to the top of my list along with my mentors that kind of walked me through from the beginning, and I really truly appreciate that. From there, I created a list. Okay, so now I have say if you pick 3 residencies that fit that category, you have the rest of the 7. How can I use that to further benefit during my externship, right? So I want to pick the best limb salvage, right? So those first 3 are going to be reconstructive orthopedic, but there maybe not be the best limb salvage. What is the best limb salvage residency? Okay, I'm going to pick 1 and 2. What is the best wound care 1 and 2? What is the best research residency 1 and 2? And so on and so forth. And that's how I catered my externship. I augmented my learning capabilities, not just to say I want to be at that residency, but I say I'm my top 3 and everything else is augmenting my learning experience. I'm learning the best of the best, whether I go to that residency or not. I'm actually going to learn. I'm going to learn that month there. I'm going to learn the best of the best from the surgeons there, from the residents there, their skill sets. And I think overall that experience really made me better. And you get to connect with those residents, those students, those attendings. And typically those attendings are usually well known within the community and also nationally and within the podiatry world. So you expand your network, you expand your knowledge, and that's kind of how I set forth my externship, I guess 1 through 10 criteria, and went forth with that.
No, I like that. I like that mindset and that plan. Andrew, how did you approach the 4th year and the clerkship opportunities?
Yeah, great question. So I would like to say I was as organized and well thought out as Garrett, but that wasn't the case. I kind of went the other side of the spectrum a little bit. I didn't know what I wanted to do in residency or thereafter. So what I did, again, I kind of picked based on geography. I wanted to see, again, different areas and how they practice and what I thought I might want to do. So I kind of picked some in like the New York, New Jersey area. Then I picked in DC. Then I was down in Florida. And then I went out to Colorado just to kind of see this whole gamut and really understand what podiatry is. While I knew I wanted to do something involving sports and athletics, I wasn't sure if that would be the only pathway. So then, my list kind of came as I was at those rotations. I was able to say, okay, one, is this something I could see myself enjoying every day, whether it was through the camaraderie, whether it was through the academics, whether it was through the overall learning experience, as well as the hands-on experience. And then I looked into, one thing I always valued really highly is being part of a team. So I knew that I didn't want to be the sole resident at a program. I always liked the idea of having this team to bounce ideas off of, because you can't get far without some support. So I valued that pretty highly as well. And then one thing I also took into account was how I felt in the room compared to others. And my goal every time I was at a rotation, I wanted to feel like the dumbest person there, because that's where I felt like I would get the most out of. And I wanted to be uncomfortable in the sense of knowing like, okay, everyone else is just at such a higher level than I am, that is going to force me to be better each day. I think my list ended up accomplishing that, and I was able to whittle it down, and I was lucky enough to end up at Georgetown, which I'm grateful for, because not only is it a really well-known limb salvage center, but the amount of surgical training we received in the long run, I'm able to look back and say I can confidently do anything. So I'm grateful that I kind of took that little bit wider approach, and it worked out really well for me.
This is great. I love where this discussion is going, because a lot of students, a lot of prospective students are going to watch this podcast, and they're going to take your playbook or your blueprint. So let's take it the next step then. You've finished your clerkships. and it comes time to rank your programs. What advice would you give students that are coming up in those same positions now when it comes to ranking programs? And Andrew, if you don't mind just continuing.
Yeah. So one thing that was really, when it comes to ranking, it was a really interesting process. I don't think I've ever been in the position where I've been able to rank programs and vice versa. So just having that experience, like, okay, where do I feel like I sit with them and where do they sit with me? But at the end of the day, what I did, I tried to take the factor of, whether or not I thought they'd want me. It was what I wanted. It's my education. I wanted to be really selfish with it. So again, I took that mindset of, okay, where do I think I would work the best? And where do I think I'd get the most out of it? And then I weighed a few other factors. I'm a big believer that lifestyle is not important during residency, right? You have to be able to, that's your 3 years of maximal learning opportunities. So I think one of the biggest reasons I ended up going to MedStar and getting in, which I'm grateful for, was I wanted a really heavy workload because there's no other time in your life that you're going to end up with that. So that was one of the biggest factors of choosing that, being in a big city with that urban environment and getting who knows what walking in the door, which again, just prepares you for everything, or at least I felt, versus, having a smaller environment, maybe a better work style. I worked hard during residency, but that lifestyle, I felt like I was willing to sacrifice it because it's just going to pay dividends in the long run. So yeah, again, that team aspect, I really liked how the MedStar structure was. It was fairly autonomous. So residents were self-directed, and I thought that would play well into what I was looking for and also allow me to grow. So that's kind of how I ranked myself.
Very good. That delayed gratification is important. I had a similar experience. I went to school in California, and I ended up going to Kern Hospital in Detroit. And when my wife and I were packing up the Ryder truck to move, we thought, am I doing the right thing moving to Detroit? But I had the same mindset. You only get one chance to get great training. You got to make the most of it. Garrett, how did you go about your ranking process? And obviously it played out at East Orlando, but how'd you get there?
Yeah, great question. I think it's a daunting kind of event as you start to finalize your third and fourth year and figuring out where you want to be, where you want to go, and possibilities, right? So it's always the possibilities. And I think it's important for students to remember Casper Crit is in your favor. It's not in the residency's favor. It's in your favor to play the best possible outcomes so that you're matched accordingly. So I guess first and foremost is just be true to yourself. Always rank where you want to go, regardless of you don't feel like you have a good shot. You never know. Always rank where you want to go first, and then go from there. Second, third, fourth, and fifth. Because typically, if say you don't get your first pick, it's still going to cycle through your options. So it's in your best favor to kind of put that foot forward. Don't be scared. So I think that's sometimes they try to play the game too much, and it may not work out, or it may work out. But always be true to yourself. Stay with your gut intuition. Typically, it does work out in your favor. But with that said, so I chose mine because I did want to be local. I knew to an extent that I want to practice in Florida. My family's from here. But I knew there was a good amount of training that could kind of be parallel with the other top residencies. So I did stack my residencies, my last kind of 3 picks into Florida so that it's grouped accordingly. That gives me a better chance on kind of staying there on top of my other externships, and end up working out well for me. But going through externships, I always recommend stay in touch with not only the residents, but the attendings. If you go first, kind of circle back and say hello, write a letter, write an email, visit if you can. That'll kind of guarantee you a little bit, not an upper hand, but at least makes it fresh in the current selection process. I think that does play a part for better or for worse. It can go either way. Don't be too pushy, I can push programs away from maybe selecting you, but there's a fine line, and you'll find that once you step into that territory, Other than that, yeah, it's kind of like Andrew said, it's a lot of kind of students going through is regional. You do want to practice where you want to live. To an extent, there's maybe a handful, top 10 or something that if you train there and you're open to move, then that's amazing. But if you're trying to stay locally, there is a local presence, I think, that is important, that does have some weight and pull, because if you're trying to find a job after residency, you're most likely going to find a job kind of around your residency, unless you have some other connections or you've made those connections during residency at your hometown or another state, or you're just open to work wherever, which I don't know too many people like that. They usually have some kind of inclination of where they want to go, location or practice. But that's how I kind of stacked my selection, and I'm grateful for where I got to be. Yeah.
Oh, that's great. I have a question for both of you. One that students have been asking me for the last 2 months as they're getting organized for clerkships. In Arizona, Garrett, you remember 2 of your last 3 months in your 4th year, you have an opportunity to do a clerkship. And Andrew, it's similar, starting out clerkships in Miami. Is it to your benefit or not to do high-powered, highly desirable programs too early, like in May or June? What are your thoughts on that? Go ahead, Garrett.
Yeah. So that's it's a great question. We had a unique opportunity at Midwestern. We had an extra rotation that you could do outside elective. So I had the opportunity to kind of go with Dr. Reese as a clinic rotation. So I essentially did that as a double rotation. So I went there really early, like February. This is the Orlando residency. And then I came back in, I believe, November. So those are your powerhouse months near the end of the year. 2 reasons. It gives me 2 opportunities to make a good first impression. I'm eager. I'm willing to learn. And then they show the progression from February to November, show the progression of knowledge, right? I think you are at a deficit if you do go quite early, if you're not quite prepared, right? So if you go early in those May, kind of August, June months, you may not know that much, or you don't have a lot of exposure. So your ability to shine past, say, someone that came in October, November, may not be there unless you really do your homework and due diligence. But even then, there's stuff in externships during other rotations that you're not going to find in books or reading literature. Those are just pure hands-on surgical kind of experiences that you have to learn as you get through your externship cycle. So in my personal experience, I do recommend, if you have the opportunity, say if you're trying to hit your top tier number 1 twice, I do in the beginning, and then again, your real one at the end. If you have a visit, I would visit throughout. But if you only had one choice, I would stack it at the end, even though the competition may be fierce. Try to put a leg up against everybody else. Visit first, get in contact, try to go through ACFAS or some other medium so you can kind of introduce yourself before your visit. That way you're at least you stand out across others. So that's just my personal 2 cents. I don't know if Andrew has a similar or different logic.
Well, Andrew, what's your opinion on when you should do your clerkships for high-powered programs that are high on your priority list?
Yeah, that's a really great question, because I don't know that there's a right answer. The way I approached it, even though I knew early on that I wasn't as well prepared as the back end, in hindsight. So what I did was I tried to do my kind of what I thought were my preferred locations towards the middle end, but not the very end. I wanted to, so just like Garrett kind of pointed to, there's a benefit to doing them a little bit later, but just for like knowledge sake. But at the same time, if you do it earlier, you get the opportunity to set the tone. So what I did, there were times when I didn't know answers. I was very upfront. I'm a very honest person. And if I didn't know, I wouldn't know. But even if programs I really wanted to be at. So if I didn't know the answer in, May, June, July, August, September, October, I would. So that transferred forward. But then in those early months, even if I wasn't doing kind of to what I thought my standards should be, I would seek out the learning opportunities. I would discuss every case with the resident. I would show that while I may not know that answer, I can still be engaged and be willing to learn and demonstrate that I'm what you're looking for. So yeah, I do think, stacking mid to end is probably in your benefit, just kind of overall, because you do come across more impressively. But in the interim, you do have to find time to stand out, right? Because, I guess you guys start in Midwestern super early, right? You guys, before every other student comes around. So you have to figure out your way to stand out. And so my thought was like, okay, how do I stand out when I'm not there? One, I would stay in touch, right? I was always in touch with residents or chiefs or attendings that I really connected with. And I wasn't begging them. I was just reaching out because of genuine interest. The second thing I did, and I think, whatever tools are in your tool belt you should utilize, I figured what better way than be remembered than by giving every single person, every single residency a handwritten note. And then I gave them all a pen with my name on it. That way, every time they grabbed that pen, they were seeing Andrew Falco. So it was just like those small things, but they add up. And I still meet people today who are like, oh, I still have your pen. I'm like, oh, that's good. Thank you.
That's funny.
So yeah, it's the small things, right? Whatever you can do to separate yourself, and whether that's socially or academically, you seek that opportunity and you capitalize on it.
Yeah, absolutely.
That's and then that's a huge point that Andrew brought up. I think we do remember those students, those extras that give a little bit extra and leave a little bit extra at the end, because it ends up becoming, unfortunately, the norm. So if everybody does it and then one person doesn't do it, you kind of set yourself apart in a kind of negative connotation. So living a little thank you handwritten note, a little gift, it really does go a long way, even on the extra step cycle.
Garrett, you'll probably remember I always talk with the students about the 3% rule. If you just come in 20 minutes early and stay 20 minutes late, you offer to help the doc, can I see anybody in the hospital? Even if they don't have anybody for you to see, just the fact that you offered to stick around and work above and beyond goes a long, long way. So if I were to ask each of you, you're all well-versed in training clerks after all 3 years of residency and fellowship. Give me 3 attributes that you really love to see in a clerk. Andrew.
Okay. Yeah. Eagerness. Not being overeager, just being eager enough, being a team player, and being teachable. Those are the 3 easiest things to have me like you, right? You don't have to do anything impressive. Just be there, be willing, and be teachable.
I like
That's that. It. Garrett, will you add to the list?
Yeah. So, and I think, he stole the words out of my mouth. I would have said the same exact attributes, because I think those are really the most important ones, because you can be the smartest one in the room, but if you're none of those 3, it's not going to work out, and it's going to be a miserable 3 years for not just yourself, but the residency itself. It doesn't work very well. And I guess I would add on to dedication and being, having perseverance to push through hardships, because I think that's something that residency kind of does push you through, and then really opens up and exposes that part of medicine training that nobody really likes to talk about. And I think especially if you go on those really demanding residencies, you're going to be pushed to the limits. You're going to be going on no sleep and multiple days. And so if you don't have that ability to push through those hardships and do the eagerness and being a team player and teachable, it really makes it difficult for not just for you, but your co-residents as well, because you're going to have to take up the slack. I think being a hard worker is definitely a crucial key element also. And it's pivotal. It can make or break someone during their training.
Well said to both of you. That looks like the perfect playbook to get the residency of your choice if you're a student. So let's fast forward a little. You're in the 3rd year of your residency program. All your co-residents are looking at options. Should I get a job? Should I do a fellowship? You both went the fellowship route, and I was hoping you would kind of just spend a couple minutes talking about your mindset around fellowships, how you ultimately decided to do a fellowship. And, there's a lot of debate within the profession whether fellowship's necessary or not. So I'd love to hear your thoughts on it. Andrew, if you don't mind.
Yeah, absolutely. So I guess, again, going to MedStar, Dr. Steinberg is big on pushing fellowships, advancing the profession forward. I think our program cultivated that mindset of, fellowship isn't, you don't have to do fellowship, but it is something that almost everyone took advantage of. So it was great having those resources the year above me to be able to pick their brains. And my mindset going into the fellowship search was, again, I wanted to be selfish and I wanted to get the experience I wanted out of it. So for me, I was looking for programs that offered a balance of clinic and surgery, because one thing for all the students listening, residency, you'll do a ton of surgery, you'll do a ton, but the thing you don't get a lot of experience in is the clinical side. And if you decide, and at this point I had kind of figured out that I wanted to go the private practice route. So I really wanted to understand, I wanted complications. I wanted to understand how to manage my patients, and I wanted to understand how to bill. Thankfully, again, I didn't feel like I needed to be trained on how to do surgery. But I needed to be trained on the how to make a living. So that was one of the things I was looking at. And then again, I was also looking for that, again, selfishly, I was looking for that mentorship. I wanted, basically a smaller attending program, because at MedStar, I think I did surgery with over 40 or 50 different attendings. So I wanted one kind of style that I can hone in on, and really just, siphon all the information out of the director's brain that I could, whether it's techniques, whether it's billing, whether it's complications, whether it's just life. I wanted that kind of one-on-one mentorship. So that's really what I was seeking. Now I will say, I don't think everyone has to do a fellowship. I was not of the mindset that if I did a fellowship that everything was going to come crash into a halt, but I just felt like the reason to do a fellowship for me far outweighed the reason not to. I wanted to be able to provide my patients with the most, whether it was most knowledge or just the fact that I could say, listen, I've done all of this and I'm not the best one to help you. And I think, being able to say that confidently and in a comforting manner, because I've done a lot. So I was lucky enough to get a fellowship, and, I'm still, year and a half out. So I'm able to draw on that experience every single day. And I still reference it like I'm in fellowship last year. So, it's really left a mark on me, and, seeking out that opportunity to do more of the sports medicine kind of work with the athletes, which was what I was looking for as well. So yeah, I really tailored my search very tightly, as opposed to my residency search and my clerkship search, because at this point I had figured out what I wanted. And that's what I believe fellowship should be for you.
Okay. Fantastic. Let's talk about the exact experience in a minute. Garrett, give us your mindset in the third year of your residency program. You're trying to make decisions on what to do going forward. How did you make the decision to go fellowship route?
Yeah, great question. So I am a believer of the pathway to parity, and then setting that 10-year plan going back and see what milestones you need to hit. So even before I even started, I knew my end goal was always to be an orthopedic group. And then I looked at those that are in an orthopedic group. How did they get to where they are? What kind of resume, what kind of CV? And then if you look at the orthopedic group mindset now, they're all fellowship trained. Rarely do you ever see a general orthopedist. It's all fellowship trained, upper extremity, hip, knee, joint replacement, sports trauma. So to get on that same mindset of the pathway to parity, I really wanted to make sure, hey, I am on the same kind of training level. I have the same expertise. I am the expert of the foot and ankle. And how can I fit that orthopedic mindset and model? And like Andrew said, it's not everybody's, it doesn't fit everybody's role to go to a fellowship to be an orthopedic group. That was just my own personal experience and goals. And so that's kind of how I molded that pathway for me. And then similarly to going to Midwestern, it's the same mindset as how can I get a really strong education, and then can I specialize? And so living in Florida, I knew there's a regional pull. Same with residency, there's a regional pull in fellowship. There's even limited amount of fellowships, and I'm really grateful for the opportunity I had. But those are typically confined to the state or the region. There's a couple other ones that do nationally recognized within the orthopedic community. but that's kind of far and few in between. So doing a fellowship somewhere where you're locally recognized, where you have the authority to kind of practice what you've been trained in, I think it has a lot of weight on top of maybe a handful of other ones that you can kind of use that knowledge and use a name. And so looking at a fellowship, I really wanted one that had an orthopedic name, that had a pull within the orthopedic community that's well known, so that I can utilize that in my jobs prospective moving forward after fellowship. And then I found Dr. Bradley Lamb and found Paley Institute, and I had a really good training and background with the reconstructive side, with the trauma side. And similar how I utilized my externships to augment my learning experience to be the best of the best and try to be a sponge and learn everything that I can. You only have 1 year. I wanted to learn kind of limb deformity correction and kind of limb lengthening, distraction osteogenesis, and have that orthopedic mindset and model. And Andrew's totally right on the clinic mindset, is that you do a lot of surgery at residency. You do really good training, most of the top residency programs, but rarely do you ever get to really hone in on the clinic aspect. And I think fellowship provides that as well, because you are typically one-on-one, maybe 1-on-3 or 1-on-4, but it's a smaller attending population. So you really get to hone in on your clinic side, but also surgical side. With being at the Paley Institute with Dr. Lamb, it's you get opportunity to kind of sit on those orthopedic conferences. So we get grand rounds. So you can not only learn the foot and ankle, but also kind of the knee, kind of hip, upper extremity, spine. So you get to kind of listen in and learn the lingo per se. So once you get into that orthopedic group, you're able to kind of communicate effectively, refer out, or at least you can work together with that intent and learning experience. And so that's kind of how I chose this one versus another one. And I guess for students looking forward, what fellowships you're looking forward, I think I really do highly encourage to do that 10-year plan and look back. That way you can really cater and leverage that in your benefit.
I like that. So Andrew, so Dr. Lamb was training Garrett. Who was your mentor in your fellowship, and how did that play out?
Yeah, so I worked with Dr. Mark Mendezoon, and it was great. I mean, every day it was something new. Even if it was like the same case, there was something new I learned. And he's still someone I call regularly to discuss cases with. Still someone I pick his brain just about in general. And, he's in a really unique position. He's in an orthopedic group. So I was able to see that side of things. I was able to be a part of that group. And then he's also, the local hospital podiatrist where he's on call 24/7. So the experience of kind of the private practice, but then still having that hospital setting was a really amazing experience to see. And it was, I had one co-fellow as well. So again, it was nice to be able to bounce ideas off of him. And when Dr. Mendezoon wasn't there, we'd run clinic. So I got that experience, right? And then, I was able to learn the billing, and he was always there to answer the questions. And I'm just grateful for the fact that he took a chance on me and allowed me, be part of taking care of his patients. And, he welcomes you just like he welcomed any part of his family. So it was really a seamless transition from residency to fellowship, and then fellowship to private practice. Just, he made it so easy for me.
Oh, that's excellent. Let's talk for a minute about your current situations. So Garrett, you're in West Palm. You stayed on at the Institute. What does your week look like usually?
Yeah, so great question. So we do 3 days of surgery, Monday, Wednesday, Friday, clinic Tuesdays and Thursdays. And then most of our, patient load is secondary referrals, tertiary referrals. Just being at the Institute, we do have quite a funnel system, a little bit unique in which a lot of referrals come not from just locally, but nationally and internationally. So being, in that area, it does give you a good amount of opportunity to learn and practice what I've been trained to do in residency and in fellowship. And forever grateful for Dr. Brad Lamb and Paley, Dr. Paley, for bringing me on and allowing me to kind of practice and stay on. It's been a wonderful experience. Never thought I would have been able to be kind of on the same criteria or in the same realm as those that have kind of pushed not just podiatric world, but also the orthopedic world. So it's been surreal and really grateful for the opportunity. And so it's, in clinic, it's nice because we run simultaneous clinics. So it's a rather large clinic. And so we get to bounce ideas off each other in clinic. And I think that's a unique opportunity. I do highly encourage, if you can find that practice model, it's really nice to have that second opinion, second eyes, not just say a phone call away, but a couple steps away. And that way you can kind of tag team on difficult patients, especially those revision complex ones that are not normal, never been done before, seen before, and needs really another think tank or kind of surgeon to kind of cater towards those patients' outcomes. Yeah.
Sounds like a great opportunity. Well done. Andrew, what's your week look like in private practice now? Just a kind of a general feel.
Yeah. Generally speaking, it's more clinic-based, so probably 4 days of clinic a week, 4.5, depending. And it's just myself, my colleague / co-resident, and then the owner of the practice. So just us 3. So a little different than what Garrett has. Presents its own unique challenges, right? We don't have that funnel system as well. So, we're kind of more on the ground doing the marketing and meeting the liaisons and finding those connections. While I'm trained to do everything and anything, I see at this point anything and everything, whether it's, the simple stuff, your bread and butter podiatry, to the complex Charcos and recons. So, the gamut is great and it keeps it fun. I think if I had one type of something, it would be a little frustrating, but the variety is really good. And, I'm happy that I ended up the pathway I did. And, to Garrett's point, having someone you can bounce ideas off of, right? Myself having my co-resident, who's also a really good friend of mine. I think we talk more than my wife and I. So we talk about cases all the time, and we're talking about business practice and how to grow. And, we refer each other patients if, one of us can't do or, is having trouble. So yeah, finding that opportunity is just immensely lucky for me.
That's great. You both have, and we all in medicine live a life of delayed gratification. And now, Garrett, you referenced the 10-year plan. And Andrew, I know you're very entrepreneurial also. What do you guys do when you're not thinking about podiatric medicine? Like, what do you do for fun and trying to recharge the battery? Andrew.
Sure. Yeah. I need a bigger battery, I think. But yeah, I like to change things up a little bit. So, outside of podiatry, I do enjoy my life, right? Spend time with my wife. We're really active. We're still playing field hockey 2-3 times a week, still running, still doing all the sports possible. And then, and all the rest of the free time, I started 2 companies. One's a medical device company working currently on like an X-Fix strengthening. And then another company is for logged. It's for residents and students and attendings to have a digital logbook to make our lives easier. Right. And it's all born out of frustration. And, I think tonight after we're done, I'm going to hop on a call and work till 10 or 11 anyway. But it's great. It just helps reset my mind, get it off of, the day to day and kind of think about, Garrett's 10-year plan, which I've ascribed to finally, just a little bit later than I would have liked, but I'm getting there. So, well,
necessity is the mother of invention. I know you've got a couple patents pending, and I wanted to congratulate you on that also.
Yeah, thank you. Yeah, it's fun. I'd encourage everybody to just find a problem that you see, and I say this as nicely as possible, but you're not special. So if you see the problem, there's someone else out there that sees the problem too, and just seek out that opportunity and do it.
Absolutely. Great advice. Garrett, what do you do when you're not thinking about podiatric medicine?
Well, right now I'm thinking about what I can make better. I gotta follow the footsteps of both of you guys right now and try to invent something or start a company. So With that said, no, I think our kind of how Andrew kind of mentioned this, that I think for us, our minds never really shut off. It's always what's next, how can we make things better, whether it be in kind of the clinic or surgery. I'm always kind of thinking, how can I make things a little bit more efficient? So it never really does turn off. I think it's just a personality trait. I think those that are in our position are usually like that, whether it be an entrepreneur or business or clinic or surgery. It's always kind of, it never turns off. Kind of always reading LinkedIn or something, trying to invent the wheel or something of that nature. But we do a fair share of kind of eating out. Me and my wife down here, we're in West Palm, so there's a lot of food restaurants that we do like to have a little fun and go out to eat. And we're close to the beach as well, so we're huge outdoor fanatics. Being at Midwestern Arizona, we did a lot of hiking. I had a list of, I think, 50 hikes and knocked out a good majority of them. So kind of carried that mindset forward in Florida. And now it's going from like mountains to beaches and trails, So I think there is a balance that needs to be done, whether you kind of decompress with your family or it's an activity, something to kind of blow some steam off. I think it's definitely needed. You don't want to go in that burnout stage because that's very real. Don't go and hit the ground running real hard and then just burn out. Take it in moderation and have a balance. I think that's crucial to kind of having a longevity career and lifestyle.
Well said. But, saying that, Garrett, and doing it are two different things because I noticed you've got like 5 pending publications out there. So it never ends, right?
It never truly ends. No.
All right. Well, I wanted to thank both of you for carving out some time in the middle of the week. It's been so enjoyable reconnecting and seeing you guys be successful. What a wonderful episode, full of great advice and pearls for prospective students and currently students that are looking at doing the clerkships and the residency and whether or not they want to do a fellowship. So thank you so much for sharing your experiences.
My pleasure. Thanks for having me.
Likewise. Thanks for having us on.
Oh, no problem. See, I'm going to send both of you one of these Dean's Chat cups. I know the hours you guys are working. You're going to put something with caffeine in it, I'm sure.
Yeah.
All right. And to all of our listeners out there, if you're listening on Apple Podcasts or Spotify, please give us a 5-star rating. If you're watching on YouTube, by all means, become a subscriber. And until next week, thank you, everyone. Cheers.